Hello everyone. In this video I'm going to cover post-traumatic stress disorder. And a lot of times when we think about post-traumatic stress disorder, we think about our military members, but post-traumatic stress disorder occurs in everyday people as well. It's really a psychological disorder that's caused by exposure to events involving death, a serious injury, a threat to your own life, and it can be sexual violence, domestic violence, child abuse. Many events in life can be traumatic and lead to post-traumatic stress disorder. People that suffer from post-traumatic stress disorder, the main symptom of post-traumatic stress disorder is flashbacks and nightmares and disturbing memories about the traumatic event, just not being able to shake it or to let it go. It's about 3.5% in the general population, but it's 20 to 30% in among our military members. So our military members are definitely being exposed to traumatic events and returning with post-traumatic stress disorder and in need of treatment for that. The diagnosis was created in 1977 after Vietnam and recognizing that many people were suffering from a disorder that had some pretty similar symptoms. So some of the symptoms of PTSD are listed over here. There's tons of different symptoms, and it looks different in every person. So somebody that comes back from the military that has been in a situation where their life was threatened maybe on a daily basis, it's definitely going to be hypervigilant. And one of the problems is that even though they know that they're home and they're safe and they're back in the States and there isn't a threat to their life, it's really hard for their brain to shut off because they've been so used to being so hypervigilant for so long that it's really difficult for them not to be that way. PTSD sufferers can suffer from anxiety, but it can also be irritability. So, we think of depressed people as being sad, but oftentimes they can be angry and irritable as well. Difficulty sleeping, which can lead to all sorts of issues, depression and suicide. But the cardinal symptom of post-traumatic stress disorder is flashbacks and what we call dissociative reactions, where the person just all of a sudden has a memory that is triggered and they just feel like they're right back in the moment. Dissociative reaction means like kind of an out-of-body experience where you feel like you lose where you're at. You feel like you are really right back in that moment. And you can imagine how debilitating that might be in the middle of your day trying to study for class or, listen in class. If this happens often enough, it can be really not only distressing, but also really cause a lot of dysfunction in your life. And a lot of times flashbacks can get triggered by weird things, by things that you see, by smells, by things that you might hear, different sounds that you might hear, especially people in the military that were very hyper vigilant. They often listening for certain slight sounds and different things. A lot of firefighters sometimes will describe different smells at different accident scenes because you smell certain things that you don't smell every day. And sometimes those things can trigger a flashback and a memory. And a lot of times people aren't aware of that. And all of a sudden they're having this memory and they don't understand where it even came from. But often they saw something or heard something or smelled something that triggered that. And a lot of times people with post-traumatic stress will avoid any kind of cues that might be related to the event so they can try to avoid having these flashbacks. And often just general psychological symptoms are feelings of guilt, like, I wish, somehow, why am I alive and my buddy's not alive? Helplessness, isolation, irritability, aggressive behaviors. So these symptoms have to have lasted longer than a month. If they haven't lasted longer than a month, then it's called acute stress disorder rather than post-traumatic stress disorder. And I don't know if I talked about, having a car accident is kind of a traumatic event. If you've ever been in a car accident, minor or major, depending on what kind of car accident it was, you can definitely have a stress reaction to that, and it can turn into a post-traumatic stress disorder as well. But if you've ever been into a car accident, and, when you got home that night, did you have trouble sleeping? Could you not stop thinking about the accident and what could have done different, whatever? And then the next day, was it difficult for you to drive past that intersection? Did you completely avoid driving past that intersection? Those are all signs of an acute stress disorder. And somebody with post-traumatic stress disorder would definitely, it can start out that way. And it really has a lot to do with how severe the accident was. So how severe was the trauma that determines whether or not you might develop post-traumatic stress disorder. Is it a repetition of the trauma? Did the trauma happen one time, or did it happen multiple times? How long was the person exposed to trauma? You think about military members on a 6-month deployment. Were they did they have to be hypervigilant every day? Did they feel that their life was threatened every day, or did it happen once or twice? What kind of social support does the person have? What was their mental health like and their stress level like before they experienced that traumatic event? Also, in our military members, we also see a lot of complications from concussions from bomb blasts. And this is kind of an invisible brain injury that soldiers are exposed to. I don't know what do you call it, but like their brain gets shook up from a bomb blast being very nearby, and it can actually lead to brain damage, especially repeated exposure to bomb blasts. The same with our football players and athletes that are having chronic concussions. So what other life experiences other than war can lead to post-traumatic stress disorder? Well, bank robberies. I used to do debriefings for bank robberies, and I would debrief the tellers that um, were involved in the robbery. And actually, I did a few what they call takedown robberies, where um, 3 or 4 people would come in with guns and tell everybody to get down, and they jump to the counter and force the employees to open up the drawers and give them all the money. Those were pretty traumatic experiences for people, and many of them had trouble returning to work the next day because they were afraid about how safe it might be or whether their people would come back. Some of them had guilt about, handing over the money too quickly, too easily. There's a lot of issues that come up when you have a traumatic experience that's out of the realm of normalcy. So car accidents, just witnessing physical injury or death of somebody, and certainly a threat to your own life. Things like natural disasters, all sorts of different types of abuse can certainly lead to post-traumatic stress disorder. There are many occupations that may also be at risk for post-traumatic stress disorder. It was first recognized in the fire departments that we had a lot of firefighters that were committing suicide and depressed and having substance abuse and aggression issues. And what they found was that constantly dealing with trauma and death can really wear on your psyche and create psychological problems, and it also create what we call burnout. So these are all signs of job burnout. And we forget sometimes about police officers and how much trauma they actually deal with. And unfortunately, the police departments don't really have a good debriefing program. Many fire departments have really good programs where they have a psychological professional that meets with them once a week in a kind of a group meeting where they go over the traumatic events or traumatic situations that they've had to deal with that particular week. And oftentimes police officers don't get that, and they deal with just as much trauma as the firefighters do as well. And the same with emergency room workers, EMTs, and all sorts of people in the medical field are, constantly dealing with some pretty sad situations. We think about COVID, and, seeing somebody die is really hard. And then to see many, many people die and, have to tell the family members, pretty traumatic experience and can really wear on your psyche after a long period of time. So there are many occupations that are at risk for post-traumatic stress disorder, and just job burnout in general. And we can prevent that by doing debriefings and really monitoring and helping people, being there for people that we know could be suffering. So how do we treat PTSD? Well, cognitive therapy, sometimes exposure therapy and systematic desensitization can be really good for military members when they're having flashbacks that are triggered by different cues, if they can get used to those cues and really learn to differentiate between those cues and the cues that they maybe had to deal with in the battlefield. Meditation is always good for anxiety. Group therapy is really effective with post-traumatic stress disorder. It's really effective with fire departments and police departments because it helps people to not feel so alone and to really understand that their reactions are really normal. It's one of the most important things about debriefings is to allow people or help people to understand that all of their reactions are really normal reactions to a really abnormal event. And it can really help in their recovery just to know that other people have had the same experiences and they're not crazy. It would be a really good idea to debrief out in the field for military members, and we don't see that a lot. We don't see a lot of debriefing of military members, and I think that hopefully we will see more. But really heading off the problem before it becomes a problem is a really good idea. Medications for depression can be prescribed. Anxiety medications I would not recommend. And there is a new treatment called the stellate ganglion block, and it was a few years back. I'm not sure now if it is been used. Unfortunately, it looked really promising, I think, in the beginning, and now they're not really sure. But the thing that it appeared to do, and it's something that it's a treatment that was used for pain, chronic pain that people just could not recover from. And what it does is it blocks those pain messages. And what they had found with post-traumatic stress disorder is some patients really felt like it totally reset their sympathetic nervous system. Some patients said, I had the first night of sleep since I've returned from the military. So it's still inconclusive, but it's definitely an indication of the biological component of post-traumatic stress disorder, and that it's that sympathetic nervous system that just won't shut down, and people that suffer from it because they've been so vigilant for so long that the system just won't shut down for them. So that is it about post-traumatic stress disorder. It is absolutely a true disorder, and it's a disorder that people truly do suffer from and that people can get help with, but it's definitely, the effects of trauma can be really long-term and long-lasting, and we can help. We can't take away the trauma. I guess that's one of the things I always said when I did debriefings is we can't erase what happened to people. We can't erase that trauma, but what we can do is keep it from being worse than it was and help the person to cope with those symptoms and understand that those symptoms oftentimes are normal, and that if you don't make them bigger, they will subside somewhat on their own. So thanks for listening.